It has now been 6 weeks since the Affordable Care Act's new marketplaces opened for business. I think it's fair to say that the rollout has been rough so far. Today, I want to talk about what we know after these first few weeks and what we're doing to implement and improve the law. In the first month, more than 100,000 Americans successfully enrolled in new insurance plans. The problems of the website have prevented too many Americans from completing the enrollment process, and that's on us, not on them. And there's no question that if the website were working as it's supposed to, that number would be much higher of people who've actually enrolled. So that's problem number one, making sure that the website works the way it's supposed to. The other problem that has received a lot of attention concerns Americans who've received letters from their insurers that they may be losing the plans they bought in the old individual market, often because they no longer meet the law's requirements to cover basic benefits like prescription drugs or doctor's visits. I completely get how upsetting this can be for a lot of Americans, particularly after assurances they heard from me that if they had a plan that they liked, they could keep it. And to those Americans, I hear you loud and clear. I said that I would do everything we can to fix this problem, and today I'm offering an idea that will help do it. People who have plans that predate the Affordable Care Act can keep those plans if they haven't changed. That was already in the law. That's what's called a grandfather clause. It was included in the law. Today we're going to extend that principle both to people whose plans have changed since the law took effect and to people who bought plans since the law took effect. So state insurance commissioners still have the power to decide what plans can and can't be sold in their states, but the bottom line is insurers can extend current plans that would otherwise be canceled into 2014, and Americans whose plans have been canceled can choose to re-enroll in the same kind of plan. So if you received one of these letters, I'd encourage you to take a look at the marketplace. Even if the website isn't working as smoothly as it should be for everybody yet, the plan comparison tool that lets you browse costs for new plans near you is working just fine. Now, this fix won't solve every problem for every person, but it's going to help a lot of people. Doing more will require work with Congress. And I've said from the beginning, I'm willing to work with Democrats and Republicans to fix problems as they arise. This is an example of what I was talking about. We can always make this law work better. The old individual market was not working well. And it's important that we don't pretend that somehow that's a place worth going back to. And that's why I will not accept proposals that are just another brazen attempt to undermine or repeal the overall law and drag us back into a broken system. We will continue to make the case, even to folks who choose to keep their own plans, that they should shop around in the new marketplace because there's a good chance that they'll be able to buy better insurance at lower cost. You know, I understand why folks are frustrated. I would be too, because sometimes, people look at what's taking place in Washington and they say, not enough is getting done that helps me. Regardless of what Congress does, ultimately I'm the President of the United States, and they expect me to do something about it. That's on me. I mean, we fumbled the rollout on this healthcare law, and we should have done a better job getting that right on day one, not on day 28 or on day 40. On the website, I was not informed directly that the website would not be working as the way it was supposed to. Had I been informed, I wouldn't be going out saying, boy, this is going to be great. I don't think I'm stupid enough to go around saying this is going to be like shopping on Amazon or Travelocity a week before the website opens if I thought that it wasn't going to work. With respect to the pledge I made that if you like your plan, you can keep it. I think, and I've said in interviews that there is no doubt that the way I put that forward unequivocally ended up not being accurate. You have an individual market that accounts for about 5% of the population, and our working assumption was, my working assumption was, that the majority of those folks would find better policies at lower costs or the same costs in the marketplaces. The universe of folks who potentially would not find a better deal in the marketplaces, the grandfather clause would work sufficiently for them. And it didn't. And again, that's on us, which is why that's on me. And that's why I'm trying to fix it. My expectation was that for 98% of the American people, either it genuinely wouldn't change at all, or they'd be pleasantly surprised with the options in the marketplace, and that the grandfather clause would cover the rest. That proved not to be the case. And that's on me. And the American people, those who got cancellation notices, do deserve and have received an apology from me. The fact that you've got this this percentage of people who've had this impact, I want them to know that their senator or congressman, they were making representations based on what I told them and what this White House and our administrative staff told them. And so it's not on them, it's on us. But it is something that we intend to fix. The federal government does a lot of things really well. One of the things it does not do well is information technology procurement. This is kind of a systematic problem that we have across the board. But I'm also somebody who, if I fumble the ball, I'm going to wait until I get the next play, and then I'm going to try to run as hard as I can and do right by the team. So, ultimately, I'm the head of this team. We did fumble the ball on it, and what I'm going to do is make sure that we get it fixed. The website will work much better on November 30th, December 1st, than it worked certainly on October 1st. That's a pretty low bar. I think it is not possible for me to guarantee that 100% of the people, 100% of the time, going on this website will have a perfectly seamless, smooth experience. We're going to have to continue to improve it even after November 30th, December 1st. What we're also discovering is that insurance is complicated to buy. And another mistake that we made, I think, was underestimating the difficulties of people purchasing insurance online. Buying health insurance is never going to be like buying a song on iTunes. It's just a much more complicated transaction. All of which is to say that on December 1st, November 30th, it will be a lot better. But there will still be some problems. Everybody is properly focused on us not doing a good job on the rollout. And that's legitimate, and I get it. There have been times where I thought we were kind of, slapped around a little bit unjustly. This one's deserved, right? It's on us. Am I going to have to do some work to rebuild confidence around some of our initiatives? Yeah. But part of this job is the things that go right, you guys aren't going to write about. The things that go wrong get prominent attention. That's how it's always been. That's not unique to me as president. And I'm up to the challenge. We're going to get this done. All right? Thank you, everybody.